The Prime Minister used a visit to a hospital in Surrey to acknowledge that the delays were frustrating, and promised the treatment would be rescheduled as soon as possible. And she spoke out after a former Downing Street advisor called for a wide-ranging overhaul of the NHS with higher taxes to increase its funding. Nick Timothy, who was one of her chiefs of staff before last summer's general election, called for a cross-party probe into health and suggested people aged over 40 should pay higher national insurance contributions to help cover the cost of elderly care. Mrs May toured Frimley Park Hospital near Camberley following announcement that tens of thousands of operations have been put on hold for at least a month to allow doctors to focus on urgent cases. Theresa May visited Frimley Park Hospital in Surrey and acknowledged that delays were frustrating. "I know it's difficult, I know it's frustrating, I know it's disappointing for people, and I apologise." Theresa May, the Prime Minister, said, "I know it's difficult, I know it's frustrating, I know it's disappointing for people, and I apologise." Mrs May insisted the NHS was better prepared for this winter than ever before. She said, "Of course there are winter pressures that the staff are having to cope with. We've put extra resources in. We've planned measures to ensure that people who need urgent care are getting the treatment and getting that care. There are the pressures there, but whatever resources we put in, actually what makes the difference is the staff. It's the hard work and dedication of NHS staff." May spoke to a patient during her visit to the hospital, which is located near Camberley. The Prime Minister defended the government's spending on the health service, saying record levels of funding are going into the NHS. She added that the winter pressures facing the NHS had been planned for better than ever before. In a separate message on Twitter, the Prime Minister wrote, "Thank you to the NHS staff who work hard and do a fantastic job for us day in and day out all year round. The dedication ensures people get the treatment they need. We've put in an additional £437 million to help, so the NHS has been better prepared than ever this winter." Mr Timothy, who is known to regularly speak to Mrs May and occasionally raises ideas in public that are being discussed in Downing Street, urged the government to launch a cross-party royal commission into the future of health and social care. He said the honest truth is that health spending is not rising fast enough to allow the service to cope with increasing demand. Mr Timothy also called for urgent measures to increase NHS funding to cope with the growth in demand for treatment. He said ministers could lift the cap on the social care element of council tax bills altogether. Thursday, February 9, 2017. Another option might be to increase employees' national insurance contributions, to ensure the younger generation does not pay, yet again, for our aging society. The increase could be limited to workers above the age of 40. Responding to Mrs May's comments, Labour leader Jeremy Corbyn said it was not good enough to say the problems are frustrating and disappointing, stating that the Tory government has caused this crisis. He tweeted, "Nurses, doctors and patients are pleading with her to properly fund our health service, but she is ignoring them.